All right, guys, today I'm going to talk about the tonsils and I'm going to talk about the adenoids. This is just one of 4 different weeks that I'm going to be doing when it comes to the 4 different organs that are commonly removed that by doctors that you still absolutely need. So today I'm going to talk about the tonsils. I'm going to talk about the adenoids, why they're important, and what could be causing them to become inflamed, what can be causing them to actually become swollen. Now, full disclosure, when it comes to some of these things, is there a time and place where an organ might need to be removed? And the answer is yes. It might be to a place where the organ has gotten so damaged, has gotten so scarred, like even sometimes in the cases of the tonsils or the adenoids, to where they're not going to be able to recover on their own. So, when it comes to that, there is a time, there's a place. The whole idea is don't let it get to the point where they become so damaged and they become so inflamed that they cannot recover. Now, full disclosure, well, this is actually near and dear to my heart. And the reason why is because I had my tonsils out when I was 21 years of age. So I was actually someone who would always get strep infections in the throat, in the tonsils. They would swell up, sometimes pus pockets. I mean, you name it. I always had these issues that were taking place in through my tonsils. So all those things were getting swollen. I went through this of having this for over 10 years. And then finally, it just reached a point where I developed a strep infection in my throat. And then when I developed that infection, I actually went on antibiotics for 10 days. And then after about 3 days after I was off, the infection came right back. And in fact, I went through being on antibiotics for over 90 days straight. And finally, the ear, nose, and throat specialist said, you know what, you're just going to need to get them out. At that point, did I need to get them out? It's tough to say because I don't really know how bad they were at that point. I didn't have any level of knowledge or anything like that. However, no, not at one time did any ear, nose, and throat specialist or anything ever say, maybe we need to look to why the tonsils are actually becoming inflamed. So what I'm going to go over with you tonight is I'm going to go over with you what makes the tonsils inflamed, the purpose of the tonsils. And then if your child especially is having problems with their tonsils and adenoids, because I guarantee you they're going to have some problems with ear infections as well, where you need to look at and where you need to address it so that you can save your child's tonsils and you can save their adenoids. Now, the reason why I'm going over these 4 different organs is because so many times in the medical profession says, you know what, you really don't need this organ. It's really not that important. But there is a purpose for the tonsils and adenoids, and there's a purpose for those other 3 that I'm going to be going over each and every week. There's a purpose for them. I'm going to show you actually why. And so we got to stop just cutting organs out and somehow thinking that we are healthier as a result of it. So let's talk about the tonsils. The first thing I want to talk about is the tonsils is what are they? What are the tonsils? Well, when you look at the tonsils and you look at the adenoids, it's a group of lymphatic tissue, okay? Now, lymphatic tissue is actually where your adaptive immune system hangs out. And what I mean by adaptive immune system is this is where things like your B cells that secrete antibodies and T cells that help to clean up damage, specifically even like things like viral infections and cancer cells and things like that. And so this is where they hang out within this lymph tissue. Now, it also helps to filter toxins as you inhale them through your mouth or through your nose. So it provides a first line of defense before it ends up within your lungs. Now, here's what's interesting to know is that adenoids, for example, they start to grow, at birth. And then as you reach like adolescence, you'll notice that they'll start to diminish. In fact, a lot of times at adult size, the adenoids are barely even perceptible. You can't even see them. So a lot of times they'll actually disappear by adulthood. But this is the question that I want to ask you. I want to ask you this. If the tonsils and the adenoids, specifically for your kids, if they're swollen and if they're enlarged, why? Why are they swollen? Why are they large? What would make them swollen and enlarged? But the first thing you have to do is what happens when you get swelling within lymph tissue? It means that you're having an immune response. Remember, anytime you need an immune system response, you have to have an inflammatory response with it. So it means that the immune system is being activated, and there's some reason why that immune system could actually be activated. So you have to figure out, ask the question, rather than just removing them, why is the immune system actually being activated? Here's what's really, really interesting, okay? And this is actually what's known as, and this is within the scientific literature, is there actually will say this is known as adenoid face. So it's known as adenoid face. So when you talk about someone who has a facial structure like this, and what I mean by this facial structure is you'll see changes within the bridge of the nose. You will see what's known as a diminished nasolabial fold. So you don't have that little fold that goes down below the nose. You will see a upper lip that tends to go upward. So you'll see a smaller upper lip. You'll tend to see bigger front teeth, and you'll see a chin that isn't as pronounced. And also what you'll notice is many times you'll see dark circles underneath their eyes. Now, if you guys have watched TV, you always, when you look at different TV shows and things like this, a lot of times, when you look at the sickly kid who's got all of the allergies and things like that, usually you'll have a kid, on the TV show that looks like this. So the reason why do kids who have a lot of allergies, why do they look like this? And the reason why is because they're having a lot of inflammatory reactions within the tonsils and with the adenoids. And what that does is it causes the adenoids to become enlarged. And as those adenoids enlarge, then what happens is the child, it's too difficult for them to be able to breathe through the nose. It requires too much effort. So then what happens is they tend to breathe through their mouth with their mouth open. And as a result, with their development of always mouth breathing, you actually will see a change in facial structure. So this is the thing, when you look at this, if you look at kids who have chronic allergies, because remember, if they have allergies, I guarantee that they're going to have problems with their adenoids and with their tonsils because they're having allergic reactions as soon as it starts to enter the nose or enter in through the mouth. So this will actually cause changes within the whole facial structure. Now, this is what's interesting, guys, is that no one's talking about why on earth would they be inflamed. There's got to be a reason why. Remember, the tonsils and the adenoids serve a purpose. They're the first line of defense before anything can get down to the lungs. So I want you to think about it. When you remove the tonsils, when you remove the adenoids, you're removing the first line of defense between toxins and between toxins getting from the air and then down into the lungs. Now, people will say, well, I had a strep infection. And so, I don't know, I just had the strep infection. And I want you to know something when it comes to strep, okay? This is what's interesting. Guys, when you look at this right here, I want you to read this. This comes from Medical Microbiology, which is a medical textbook on microbiology. And here's what they actually said. Within the mouth and then in the upper respiratory tract, there is a varied microbial flora is found in the oral cavity, okay? And streptococcal anaerobes inhibit the gingival crevice. So the pharynx can be a point of entry, initial combination for Neisseria, Bordetella, Corynebacterium, and Streptococcus species. So here is what they actually say. Here is what they say, is they say that strep is normal flora or normal bacteria within the actual nose, with the pharynx, and within the upper respiratory tract, and also within the mouth. Guys, when you have tooth decay or you have a cavity, all it is the bacteria. You're providing the bacteria food because their primary thing that they like to eat the most are simple sugars. And as they produce their metabolites, the metabolites are actually what wear down the enamel. So if someone has a strep infection, all it is an overgrowth. Think about it. It's an overgrowth of normal bacteria within the pharynx, within the nose, within the upper respiratory tract, and within the mouth. It's normal flora. So I want you to think about it. Someone gets a strep infection, your child gets a strep infection. They say this: many elements of normal flora may act as opportunistic pathogens, especially in hosts rendered susceptible by rheumatic heart disease. Pay attention: immunosuppression, radiation therapy, chemotherapy, perforated mucous membranes, etc. Okay. Now, what they mean is is they mean that the only time that this can actually grow is when the immune system is suppressed. So if your child is always getting sick and they're getting chronic strep infections within the throat, then they are what they said, this is normal flora, and your child is immunocompromised, meaning the immune system does not have sufficiency to be able to fight it off. So we have to stop killing just normal bacteria within the mouth and actually start figuring out why they're actually growing. So what can cause the tonsils to become inflamed, okay? Now, remember, what they say is if they're inflamed, we can just remove them. But this is what's interesting. This comes from Science Daily, okay? Back about 2 years ago. They said that tonsil and adenoid removal associated with respiratory, allergic, and infectious disease. This is what the analysis was. By removing the tonsils and removing the adenoids in childhood, they said increases long-term risk of respiratory, allergic, and infectious diseases. According to the research who examined for the first time the long-term side effects of the operation, okay? Here's what they found. Tonsillectomy, removing the tonsils, was associated with almost tripled relative risk of having things like asthma, the flu, pneumonia, and chronic obstructive pulmonary disorder, or COPD. Basically, what they're saying is now you've lost your first line of defense of actually being able to handle a viral infection. And it goes now straight to the lungs, which now you're causing an increased risk of having an inflammatory response within the lungs, okay? So adenectomy, so removing the adenoids, was found to be linked with more than a doubled relative risk of COPD and nearly double relative risk of upper respiratory tract diseases and also conjunctivitis. So what they are actually finding is you remove the tonsils and you're going to develop other problems downstream into the lungs because you've taken away the primary immune system organs. That's your first line of defense of having any kind of reaction to protect you. So there's a purpose for the adenoids. There's a purpose for the tonsils. And just remember this, when they're becoming inflamed, guess what? They're inflamed for a reason, okay? Now, here's one of the things we always look at in our office when we have a child who has any kind of swollen adenoids or swollen tonsils, or they're chronically getting infected, okay? One of the things they found when they looked at these children who had problems with their adenoids and with their tonsils this actually comes from PubMed, okay? When I pull research, this comes from PubMed, which comes from the National Institute of Health, National Library of Health. This is things that you can actually find on your own, but it comes from peer-reviewed journal. Just remember this, peer-reviewed journal just isn't here in the United States. It actually comes from other countries as well. So one of the things they actually found is they found that children who had problems with their adenoids and with their tonsils, they found in almost all of these people a higher incidence of what are known as IgE, inflammatory reactions taking place. So they found an increase in IgE infections, okay? Now, one of the things that we do in our office all the time is we test people with their foods for having an IgE reaction. Guys, if your child has an IgE reaction to foods, it doesn't have to necessarily cause death. You can have it in a small amount or you can have it in a very large amount. But if they're having an IgE reaction to a specific food, like peanuts, like eggs, and we're testing for the 8 of the most prominent ones that are taking place, the first thing that I always say is when a child is always having the swollen tonsils and adenoids, and they're only 2, 2.5, 4, 5 years of age, is I say, check the foods. There's got to be something that when they eat certain things that's causing a local inflammatory reactions within the tonsils and within the adenoids. So you're seeing literally in 61% of the cases that they actually had an IgE food allergy that was taking place. Now, an IgE food allergy is something that happens right away. In fact, this is what you actually associate with more of having an immediate allergic type reaction or anaphylaxis and things like that. But when you start to go a little bit further, you also will see that not only do these kids have an IgE reaction, but they have an IgG reaction. Now, this is a different type of immune system reaction that takes place within the body. And in fact, IgGs are the most abundant and most common antibody that takes place through the body. But IgEs can happen a lot slower. IgGs happen almost immediately. IgGs are going to happen, it can happen as up to 5, 6, even 7 days, which is why you'll never be able to identify if they have some kind of problem with the food, because it can take so long before you start to have any kind of clinical symptoms going on. So in this, again, in this article, it came from PubMed. They actually said that we want to explore the relationship between food intolerance. And by the way, we don't call it food intolerance. We call it hypersensitivity. And hypersensitivity is an allergy and adenoidal hypertrophy, according to provide evidence for intolerance and adenoid hypertrophy. So they said, is there a correlation between having IgG food hypersensitivities and to having swollen adenoids? And here's what they actually found. So the food intolerance detected of a positive rate of adenoidal hypertrophy group was higher than the control group. The distribution of two groups and the extent of food intolerance is different, and adenoid hypertrophy and how many types of food, which is high, as moderate intolerance, are unrelated, okay? Now, here's what they find. The daily consumption of 14 kinds of food, the top 3 foods that are associated with adenoidal hypertrophy in the control group were eggs, milk, and cod, okay? Now, how many of you give your child milk? How many of you give them eggs? And how many of them, I don't know if you give them fish sticks, but these are some of the most common ones. So the common ones were the ones that were causing these IgG food allergies, okay? And what they concluded is this: food intolerance or hypersensitivity is a possible cause for adenoid hypertrophy or enlargement. So the detection of specific IgG antibodies of food have a positive significance in the prevention of having enlarged adenoids. Guys, if your child has enlarged adenoids, get your child's foods tested. Please get them tested. Because when you start to remove the things that are causing the inflammatory response, then a natural occurrence is for inflammation to start to go down. And then you'll see the adenoids start to get smaller. So when your doctor says, I guess your child was born with enlarged adenoids, that doesn't make sense. They're enlarged for a reason. And could it be because the foods that we're giving to them are causing an inflammatory response? Now, I'm not going to get into why kids have IgEs or why they can have IgGs, but just remember this, is that today, mothers don't breastfeed as long as they're supposed to, as long as we're designed to. We're introducing foods way too early within our child. Where there's a lot of C-sections today, and our babies, our children are not exposed to even normal probiotics that help to regulate the immune system. And we're introducing foreign particles within our children at 6 months of age, 12 months of age, even when the body can't even mount a sufficient antibody response. So we have to start doing it differently. But the answer is that we got to stop just indiscriminately taking out adenoids and taking out tonsils when your child has the ability to be able to recover and heal. We just need to figure out what's causing the inflammatory response. I want you guys to understand this, because remember the research that I just went over. You take out the adenoids, you take out the tonsils, and now there is an increased risk of having things like COPD, having asthma, having an increase of infections within the lungs, because the body works together like a Swiss watch. We have to start looking at healthcare as the body being a Swiss watch, and not saying, well, we can just take this organ out and nothing else is going to be infected. When we take a medication for the heart, it affects every single organ function within the body. When we remove an organ, it affects every single organ function within the body. When we are stressed, it affects every single organ function within the body. When we are having an inflammatory response, it affects every single organ function within the body. And this is why for us, we don't really have a protocol. Because when you start looking at, health issues, we start looking into the question, why? Why? Why is this happening? And what other organ systems is this being affected? And where is the main problem coming from? So when you affect the immune system, you actually will affect every single organ system within the body, which is why when we talk about women and hormones, guys, women and hormones, one of the biggest things is due to stress and due to the immune system. And it really has not as much to do with the actual hormones. Hormones don't go bad by themselves. They are a reaction to some kind of problem within this whole entire Swiss watch. So here's the thing: when it comes to your kids, if they have swollen tonsils, swollen adenoids, and guys, please share this so that we can start saving kids from getting their tonsils out and their adenoids out. Because remember, you can remove it, but you're removing a symptom. You are still leaving the problem. Let me say that again. When you remove the tonsils and adenoids, you're removing the symptom. You are still not removing the actual problem. So the first thing you have to do is you have to figure out what the triggers are and start removing those triggers. Start removing those inflammatory triggers. The tonsils don't get swollen on their own for no reason. They don't get enlarged for no reason. Number two, figure out what's happening with the spine and the nerve system, especially due to any kind of physical interference that's taking place. You know how many kids have come in with ear infections, and actually after adjusting them, they no longer had ear infections. So here is me. Well, I grew up having asthma, having tons of allergies, being on antibiotics, getting my tonsils out, getting my adenoids out, and having, like I said, a lot of ear infections. But my 3 kids who share my genetic expression with myself and with my wife, here they have literally in my ear infections that I can count on one hand. They've never had swollen tonsils, and they've never had swollen lymph nodes or adenoids. They've never had those things before. And it's not because we're great parents, it's because we understand this principle. And we understand that when they're sick, there's a reason why they are. So my kids get adjusted. My kids know what their food allergies are. So you got to make sure that you are starting to address those 2 things, especially when it comes to kids. Get their food allergies tested so that you know that what you are giving them is not a poison for them. You have to be keeping your organs, the tonsils and the adenoids. Guys, these are so important, especially when it comes to kids, because you can rip out organs. You're only taking care of the symptom. You're not taking care of the biggest problem, the reason why it's there. So, hey guys, coming up next Saturday, we're going to be going over autoimmunity. Okay. So this Saturday, it's going to be a webinar, autoimmunity. If you guys search our page, you'll see that we have that in an event. All you have to do is click it and then click on our webinar jam link and go ahead and sign up for it. The webinar is going to be probably about an hour long, but we're going to give you a different perspective when it comes, guys, to autoimmunity. And we look at autoimmunity from a different perspective because, guys, if we continue to have the same perspective of how it's handled medically, you are going to get the same result. It's not about giving more steroids. It's not about just continue to give more drugs for it, because one of the things that we have now found out, if you look at autoimmunity over the last 70 years, it has absolutely exploded. And some of the most used drugs today are now for autoimmune conditions. And if you research and look at the side effects, they actually say long-term use has been linked to infection and has also been linked to cancer. I'm going to show you why that is coming up this Saturday, 9:00 a.m. You can register for it. It's online. You don't have to get ready for it. You don't have to come to the office. All you need is a computer that you can watch, you can listen, and you can learn. We are all about helping people. We are all about starting to change how we start to view healthcare, because if we don't change the way that we view our healthcare, we don't have a different perspective, then we're just going to expect for things to continue to stay the same, but not even stay the same. It's going to continue to get much, much worse. So we're going to give you a different perspective on that autoimmunity talk. And what are some of the things that we're going to be covering? Guys, autoimmunity is our most thyroid issues. We just had a lady who came in today, thyroid issues for the last 5 years. We took one look at her labs and said, did they tell you that you're having an autoimmune condition on your labs? She said, no one ever told me this. She is actually on, or all of her labs are perfect according to the medical doctor. Normal labs, yet she continues to feel like garbage, not having any energy, put on weight, and her hair is falling out. Yet her labs, according to the doctor, look completely normal. And we're going to show you why that is and what you need to be looking for, because most of with thyroid issues, most of it is autoimmunity. So we're going to cover with you the triggers, what can be triggering it, but really what you have to do to restore the immune system so that it gets back to normal inside of the body. So this Saturday, 9 o'clock a.m. Central Standard Time. And guys, next week, one of the things I'm going to go over is the gallbladder. All right. Now, we went over for kids the tonsils and the adenoids, but next week we're going to talk about something that has affected women greatly. We're going to talk about the gallbladder, why you need it and why they take it out so indiscriminately. But really, getting your gallbladder removed is not because you have a diseased gallbladder. You have a problem with bile metabolism, and that is made in the liver. And if you notice this, I'll leave you with this, guys. Have you noticed that when women who have gotten their gallbladder out, do you see that women have an increase in chronic pain? They have an increase in problems with digestion. They have a problem with itchy skin. They have a problem with estrogen metabolism. They have a problem with their fertility, because all of those different things all are tied into the liver when it comes to hormone function, bile metabolism, vitamin D function, digestion, all of those different things. We're going to help you connect the dots on that live coming up, and we'll be doing that next week. Make sure you like and subscribe to our page so that you can get a reminder that we're going to be going live, and we're going to be talking about the gallbladder. Guys, this is going to blow you out of the water, and we're going to talk about what you have to do if you have gotten your gallbladder removed, but also what you need to do in order to make sure that you keep your gallbladder because you need it. Guys, if you have any questions, leave a comment below. This Tuesday, tomorrow at 11 o'clock, we're going to be doing a live Q&A. So if you have any questions too regarding that, go ahead and just drop them into the comments, and I'll read those and make sure we answer any remaining questions that we have with what we went over tonight. But if you have any other questions regarding health, regarding wellness, whatever they might be, leave those questions too, and we'll do a live question and answer tomorrow at 11 o'clock a.m. I look forward to seeing you guys there. Thanks for joining. Remember that you share this with someone who has had issues with their adenoids and with their tonsils. Let them know what about this so that they know what they can do in order to help their children greatly, guys. Have a blessed Monday evening, and we'll see you soon.